It's part of the Chancellor's plan to create what's been labelled a northern powerhouse, a bid to provide an economic hub to rival London. And the amount involved is no small sum. The Chancellor proposes to give Greater Manchester the region's full health budget, all £6 billion of it.
Well, we are discussing a plan to bring the local NHS and social care closer together in Greater Manchester so we deliver a better service for patients. This is what the NHS wants to see as part of its own future, and it's also about giving people in Manchester greater control over their own affairs in that city, which is central to our vision of the Northern Powerhouse.
Hospital.
Dr Ahmed works in one of the most deprived areas of the north of England and welcomes the proposals using a motoring analogy.
In the past, the NHS, we've had a puncture tyre, put another tyre, bumper's broken, put bumper on, and that's how we've plodded along in the past. And what we need for the future is possibly developing a new car that's fit for purpose for the future and essentially future-proof, so we can deliver a holistic approach to patient care, the whole person approach, and it's patient-centred.
Like surgeries and hospitals across England, those in Manchester have been overwhelmed in recent years by the numbers of patients with long-term illnesses. In the past 10 years, there's been a 35% increase in unplanned hospital admissions across the city. They're made up mostly of people suffering from sometimes complex conditions, such as obesity, diabetes, depression and dementia. In this city alone, that's led to a £1.1 billion funding gap. Do the Chancellor's proposals provide a solution? At least one health think tank is sceptical.
The obvious risk is a financial one. The NHS and the social care system are heading for a financial crisis. And the overwhelming priority ought to be how we manage that, not plunging services into another round of reorganisation when they've barely recovered from the last one.
But health is just one part of a bigger picture in which the Conservatives are trying to appeal to northern voters. The health budget would ultimately be passed on to a sort of super mayor who would also take control of spending on housing and transport. He or she would also take over the responsibilities currently being held by the Police and Crime Commissioner. We have only a few months' wait to see whether that's something the voters want. Mike McCarthy, Sky News, Manchester.